First off, what is skin cancer? Skin cancer is an uncontrolled growth of abnormal skin cells. Sun exposure is the leading cause to skin cancer. This is because the sun's UV rays damage DNA in the skin. Usually the body can repair the damage before gene mutations and cancer form, but too much exposure and the body wears out. About 5 to 10% of patients have had a family history of skin cancer. There are 3 main types of skin cancer. The most common is the basal cell carcinoma. It's the 80% of skin cancer cases. It develops in the basal cells at the lowest layer of the skin, and more than 1 million people in the US have it. The second type is the squamous cell carcinoma, which is about 16% of skin cancer cases. It's found in the squamous cell, which is an upper layer of the skin, in about 200,000 cases a year. The last type is melanoma, which 4% of skin cancer cases. It begins in the melanocytes, which is what gives skin color. The most lethal form because it spreads rapidly through the lymph system and internal organs. Caucasian men are most susceptible to skin cancer because of their light pigment. There are 5 major types of treatments for skin cancer. The first is surgery. The tumor is cut out or removed from the infected patient in thin layers. This can be done in many ways, such as serosurgery, which is when the infected area is frozen and the cancer cells are killed and removed. The second is electrodesiccation and cutterage, where the tumor is cut out of the skin with a special type of tool, the cutterette, and then a needle-shaped electrode that sends electric currents, ending the bleeding and killing the cells and spreading. The second major type is radiation therapy, which is high-energy X-rays or other types of radiation that prevent the cells from growing and expanding. The third type is chemotherapy. This is by mouth or injection, and they are drugs that prevent the cells from growing and dividing. The fourth major type of treatment is photodynamic therapy. This uses a drug and a laser light. Basically how this works is the drug is injected into the infection and can only be activated through light. When activated, it starts killing the cells and stopping the spread. The final treatment type is biologic therapy. This gives the patient drugs made in the lab that helps boost their immune system and body's natural defense system against disease, fighting cancer and killing cells. New clinical trials are being conducted as scientists work to understand the disease more and try to figure out a better cure. Did you know that males are more susceptible to get skin cancer than women? About 1 in 50 Caucasian people get skin cancer, about 1 in 1,000 African Americans, and about 1 in 200 Hispanics. Fair skins are more likely to get skin cancer because of the softer pigment. Usually, with 1 sunburn a year, you're at about a 20% chance risk. Greater than 4 sunburns per year, you're putting yourself at a higher risk for skin cancer.
Some of the symptoms of skin cancer are as follows: a large brown spot with darker colored specks, dark areas on the nose, fingertips, toes, soles of the feet, palms of the hands, or the mucous membranes lining the mouth, a mole that changes in size, color, or feel, and bleeds, a small area of skin that seems to have an irregular colored border. Other less common symptoms are red or purple spots or patches on the skin or mucous membranes. 2 of the contributing factors to skin cancer are lifestyle and environment. Lifestyles of excessive tanning, receiving too much sun and burning, being fair-skinned, and not using sunscreen can all contribute to skin cancer. An environment with lots of sun is most susceptible to skin cancer.
The survival rates of melanoma is stage 1A. If you have 5 years after you're diagnosed, it's about 97%. Stage 2B, 5 years after, is about 70%. And stage 3C, which is the worst stage, is about 40% after your 5-year diagnosis and 24% after your 10-year diagnosis. The relationship of mitosis and cancer is that cancer cells override some of the control measures of cell division, leading to uncontrollable growth and reproduction of cancerous cells that don't contribute to your body, and they contaminate good cells, don't do any work, and take up oxygen.
What are the risk factors of melanoma?
The risk factors of melanoma are family history, personal history, or weakened immune systems, but that increases your risk of skin cancer, or if you're taking immunosuppressants, as in if you have HIV or AIDS.
What are the symptoms?
You may not have symptoms in your early stages of melanoma, but they do consist of an existing mole or mark on the skin that isn't healing, or brown or black streaks under a fingernail or toenail.
Is it serious?
It can be serious if it worsens, as in like stage 3B or A cancer.
Can melanoma be cured?
It can be cured, but you can use treatments for it, as in radiation therapy or surgeries to remove the infected parts.
Can it be prevented?
Yes, you actually can prevent melanoma by not staying in the sun, do not burn, as in put on sunscreen, and avoid using tanning beds and UV beds.
We would like to thank the following websites and articles for our research.